Welcome to the Black Marriage and Family Therapy Matters podcast, where we connect Black families to Black therapists. On Mondays, you will receive direct therapeutic support from a licensed therapist or professional connected to the mental health field. They will provide therapeutic and educational resources to help you have a healthier relationship with your family members. On Wednesdays, you will receive direct tips and resources to help you get through the stuck places that prevent many people from having the relationships with their families and significant others that they desire. On Fridays, we want you to visit our blog, which can be found at www.blackmftmatters.com, which holds additional resources and action steps that you can begin implementing immediately to improve your relationships. This is necessary because we love that you are listening, but we want you to take action too. While you are there, please grab our A to Z Relationship Bootcamp and be provided with the skills you need to immediately communicate better within your relationships. Please note that while the therapists on podcasts are therapists, they do not serve as your therapist unless you have signed a confidential agreement with them confirming that relationship. Thank you in advance for listening, and we hope you are inspired. All right, it's time for the show. Here is your host, Dr. Connie Omari.
Hey, welcome to the Black Marriage and Family Therapy Matters podcast, where we connect Black families to Black therapists. Today's awesome guest is Dr. Yolanda Fountain. She is a licensed professional counselor, approved clinical supervisor, registered play therapist and supervisor, and a board-certified counselor. She is the owner of Play Wellness, LLC in Roswell, Georgia, which provides quality mental health clinical services, supervision, and training. She is also the founder of the Child Law Center Incorporated, a nonprofit that focuses on mental, medical, and educational services for grieving parents who have experienced infertility, perinatal, infant, and child loss. Dr. Fountain has worked in the mental health field since 2006 and has taught graduate level courses at several universities. Wow, Dr. Fountain, that's absolutely amazing. Can you fill in the gaps about yourself?
Sure. And thank you for inviting me.
Of course. We're glad to have you.
So I grew up in Georgia, and I went to college, undergrad in Alabama at Alabama State University and studied business management. And then I moved back to Georgia and went to Mercer University for both of my graduate degrees in counseling. And since then, I kind of fell into counseling. I didn't know anything about it prior to, because my parent had a adverse and sort of traumatic experience with the whole counseling field, trying to get help for a sibling when I was younger. And so it kind of carried me away. I'm sorry?
No, I'm saying, okay, that's awesome.
Oh, yeah. So when I took my first class, it was quite surprising that it could be helpful and that I actually enjoyed doing it. And that has been my road to trying to enhance and advocate for mental health services for Black families. I've done some work in the school system. I've worked in a psychiatric hospital for children, teens, and young adults. I've worked in the college setting as a counselor. I've worked in private practices prior to my own. And so I've worked in home therapy. I've done a lot of different settings so I can understand a variety of backgrounds as well.
Awesome.
And also, train and supervise. So.
Awesome. Amazing. And I realize I keep saying it's awesome, but what's awesome is that you have been able to take what I'm sure was a life-changing experience for you, your parents, and your sibling, and just really flip that and make that do such great work in our communities.
Yes, because a lot of people feel that way, and they have a right to, considering the history.
Of course.
Clinical services towards Black Americans, correct?
Yeah, well, why don't we, I know that's not something we really talked about, but why don't you just tell me a little bit more about what do you mean about our history? I know what you mean, but we've got viewers who would probably want to know.
Well, there's in upholding the white supremacist system and racism in America, all of the experiments that were done on Black Americans without their permission, out of ignorance, in complete pain, dehumanization. So all of those things really tied into not only, medical models of science that was based on racism, but also mental health models.
Yes.
That was based on racism.
Yes.
And so it's very important that we have Black or Indigenous or people of color, BIPOC, to provide services to Black communities and people of Indigenous and, other people of color. Because sometimes, of course, they rightly so mistrust the providers who may not look like them, even if it's just based off of history.
That's so true. That is so true. And one of the things I really like about your approach, Dr. Fountain, and what you can bring to the forefront is you obviously have the clinical knowledge, you have the hands-on experience, which I'm sure together works to speak to your compassion, but you also have the business sense, because a number, and this is important because we connect Black families to Black therapists, so even though we have Black listeners, we also have Black clinicians who also follow the show. How would you say your business experience with respect to your education and, of course, now being a multiple business owner, how important is that when you have this compassion into the work that you do?
Oh, this is a huge thing for me because, see, when I first came into the field, I was bamboozled by some of the agency managements. And I mean, from a perspective of, I worked for my first job coming out into the field was just chaotic. And I'm so thankful that my school prepared me for what good ethics look like, because I was able to quickly realize, you know what, this is not the place for me, and I'm not going to put my license on the line because of their own mismanagement and their lack of knowledge of the law, and their intentful trying to burn out new clinicians because they usually come into the field to help. And so I immediately was aware, I had heightened awareness of the need to have effective business practices that not only supported you financially, but also supported the very people, the clinicians who were trying to provide these compassionate services to clients.
Right. Yeah, that's so important. I don't mind being transparent myself. I've made my own mistakes like in that. Sometimes as clinicians, we have our own so compassionate about the work that we're doing and our mission that sometimes if you don't have that business piece to complement it, you can really create a problem for yourself. So good for you for having done that work and setting.
Yes, it's hard work.
Oh yeah. Oh yeah, it is.
I work every day trying to work smarter, but it's hard work.
And we could go forever on to that, but I really want to kind of fine-tune this into some of the really great work that I came across from doing, and that is, your emphasis in parenting support. Like you said, you were drawn to this because of your own personal, story, which I think is awesome. If you don't know how to use your own story to leverage the power of everything, then, that's good that you just know how to do it. It's not good that you can't figure that out. But you do a lot of play therapy. Or do you? I'm assuming because of the name of your business.
Can you repeat that? I didn't hear what you just said. You said I do a lot of...
Do you do play therapy?
Oh, yes, definitely.
Yes. So I want to ask you about that because, I mean, I'm a clinician myself, and I hear that, and I think, you know, even I do some art therapy in my work, but I think we hear the word play therapy, and you might not understand what is it? What essentially is play therapy, and how can that be useful to adults as well?
Yes, so play therapy is using a solid therapeutic relationship, speaking in the child's own language of play. And so play typically for most children comes very natural. And it's also a huge communication medium. And so whereas adults use words and talk to be able to express themselves, most children naturally use play to do that. And so play therapists are trained to essentially read the child's play behaviors. Some play therapy theories involve toys. So we, in those theories, toys are their words. And some play therapy theories focus on the relationship, and they focus on the relationship of playing with the child to help enhance their mental and emotional and behavioral health. So essentially, like in my office, I have selected toys. We don't do collected toys. I mean, it's just a bunch of toys that might come from anywhere. Right. They are selected and they have intention, and they may point out themes and meanings. And so it's very important that we're intentional about our work, and we're trained to use the play with the children. And so essentially, we use play therapy with it from a theoretical perspective from ages 4 to 12. And it sometimes, you know, it cuts off at about 10, depending upon the child's development. Or can use it a little bit younger.
Right. Okay.
And so the child goes into the playroom. They can use the toys, or they can play to share what they've been through, what they need, or what they desire for the future.
Wow, that's so important, because a number of clinicians that I have for my practice will not work with children under the age of 12 because they say that they can't really get them engaged or entertain them. And what I'm hearing you say is there's a whole form of treatment that's designed.
And to be honest with you, I think in some ways it could be actually ethically harmful to try to use talk therapy with children.
Okay, tell me more.
Because a child's left brain is not fully developed. You know, they say even the frontal lobe, depending upon your research study, doesn't develop until 21 to maybe 29.
Right. Okay.
And so thinking about that left brain where you're focused on using words, that is not all the way developed until, like, with abstract thinking from Piaget's 10 to 12 years old. And so that's kind of why the cutoff is there. And so with play therapy, we're using the right brain to help them process, because the right brain forms at around 2-3. You know, and so they can use that more fully to express themselves than the expectation to use words. And so I actually get a lot of referrals from parents who say, you know, they tried to use talk therapy with my child and it just was not working.
Right. So so you do the play therapy with the child now. How does that information get translated to the parent? Or what is the adult's role?
Yeah, so there are, similar to like talk therapy theories, there are multiple play therapy theories. Some are evidence-based, some are not. We do have what's called a non-directive play therapy theory that's evidence-based, and that's called child-centered play therapy. And I actually use that for all of my assessments with children who are first referred, because it, even beyond whatever I see on the paperwork, what the parents tell me, I can really just look at their play and let them communicate everything they need from an underlying issue. There are evidence-based family play therapies, and that's where you can incorporate the families and the parents. And then there's evidence-based, what we call directive therapy. Well, there's one, Adlerian play therapy,
right? But
there's some more, but they're just not evidence-based. And so with parents, essentially, it depends on the clinician how they include the parent, but I always include my parents if they're available and they're willing, because for me, when I meet with the child, I'm only meeting with them for, an hour a week, maybe twice a week. that parent will be building a relationship with them for the rest of their life.
Right.
And so it's very important for me to be able to teach the parent some of the skills that I'm using with their child so that they can deepen their relationship with their child as well.
Right.
And feel confident in their abilities to have a successful and a healthy parent-child relationship.
That's so true. That is so true. Wow. So let me ask you this. There's a couple of things that are coming to my mind, but is there a form of play therapy that can be used with adults?
So, yes, it's not technically a theory. So when we think about play therapy as a theory, we tend to use that with children.
Okay.
However, for teens and adults, it is still important sometimes to integrate what I call just play therapy activities. So not necessarily theoretically based, but just activities that are integrated into your regular kind of talk theories like CBT or Gestalt. And so I will actually take like Gestalt play therapy activities, and if I'm using Gestalt therapy talk therapy with a client, I'll incorporate some Gestalt play therapy activities. And what that's helpful for is for the teen or adult who may have had something traumatic or very complex grief happen to them before the left brain developed. It's important for them to use that right brain activity processing so that they can still process it for when it got stuck at that age.
I love that.
Similar to, if you have an adult or teen with a traumatic brain injury, they don't depend on the left brain as much. And so they really will need to focus on right brain processing activities. And even if it's not play therapy activities, I'm also trained to do sand therapy. And so I see that that's kind of parallel to how we use play therapy with children. I'll use sand therapy with teens and adults because it's fully right brain processing where they have a tray filled with sand, and they have these things called symbols. And so they'll put different symbols. It could be furniture, it could be people, it could be, all the way from plant life to housing. And they build these kind of models and pictures in the sand to represent what the right brain needs to get out and process it. And literally you can do a full sand therapy session and no words can occur, but a host of therapy can be going on.
Wow. This is so amazing. And I know you've had to be creative in making this relevant to our community. But just hearing the way you describe this, not to play on stereotypes, but Black people, we're seen as more expressive, like using our bodies more and being more creative in general as opposed to talking. And this just seems like such a great tool and resource to rely on to encourage that type of communication and that type of process.
Yes, and I'll tell you that's why I really love play therapy, because play involves so many different things. I can incorporate art, I can incorporate drama, I can incorporate, yoga if I'm trained, which I'm really trained in. You can incorporate all kind of different kind of expressive and experiential art tools and use it in a therapeutic way and use it in an evidence-based approach.
That is awesome. That is so awesome. Well, I'm so glad that you shared that with me, of course, but our audience as well, to let people know that, listen, if you're not wanting to talk or if you're not interested in talking, you don't necessarily have to. You can still meet your mental health goals.
Yes,
that's awesome.
There are options. That's like my whole premise of the business. I set it up so that if you want to use words, you certainly may, but if the words, if your pain or your trauma is too overwhelming for words, we have options for you that work.
So are you saying that you've actually had people go in, like kids go in, and I'm sure they say like, hey and stuff, but not say anything in the therapy room about their trauma?
Oh, yes. I work with multiple children, even if you think about the diagnosis of selective mutism.
Right.
That's a choice not to, or if they have a communication disorder where they literally, their brain cannot at the moment. Yes. Work with all of that.
Wow. Oh my gosh.
But even if you think about it as an adult, there are just some traumas
that we don't talk about.
Or that you can't even put the words to.
You don't know how to talk about it.
It was more overwhelming. Your left brain can't process it yet.
Yeah, I've had a number of clients say, I don't know what I'm feeling. Like, I don't know when I'm angry until I've thrown my laptop and broken it. You know what I mean? Like, wow.
I'll also say, because my work, like, I've been providing play therapy for about 14 years. And the more I got into the work, the more I also recognized too, though, that I could be even more preventative, because I got into the work because I had done some work with some adults, and I realized, you know what, I'm helping them to heal some childhood wounds. And that's why it was very important for me early on to start working with children. And the more I work with children, the more I saw, you know what, I might need to go to infant mental health. And because and this is where kind of my passion is, and where I've been studying for about 3 or 4 years now, in helping parents, even at the prenatal level, learning how to bond with their child in utero and go ahead and start that relationship there.
Oh my goodness.
Yeah, and so working with 0 to 5 is all parent work. And so I'm trained in child parent psychotherapy, but all of that is parent-child work, and it incorporates play therapy. So,
well, go back, because I might have needed you like last year when I was pregnant. But like, are you saying that there is a mental health treatment where you can work with the mother while the baby is before the baby's even born?
Yes, and that's the way it can be used. Now, it's not as much research.
Okay.
But yes, for the particular orientation that I use is child parent psychotherapy.
Mm-hmm.
There's also something called first play therapy.
Mm-hmm.
She's out in Florida.
Okay.
And I was supposed to get trained in that this year, but COVID,
Right.
But yes, literally it is, because even if you think about, I learned about a decade ago, I was at this conference and they were talking about epigenetics and how, the trauma experience of Black people passes literally through your genes to your offspring.
Yes.
And so thinking about how do we recondition in some way those energy channels that run through our system so that we can block as much of that trauma energy as possible.
Wow.
And so I think that can come in a number of ways, even beyond therapy, like I'm getting trained right now in prenatal yoga, because I want to incorporate that. And I don't want to get all kind of disheartening here, but thinking about even for Black women, the systematic oppression that has led to pregnancy loss.
Yes.
It's much higher for Black women.
Yes.
And so using it not only to build attachment with the child that will be living, but also with those parents who are heavily grieving.
Yes. And if I remember correctly, in your bio, you also spoke about infertility as well.
Yes.
Yeah.
Well, essentially it's just child loss. And that's kind of
and that includes
the umbrella that I put for all of them under there.
But I mean, that's so true, because we have child loss and we also have, child conception issues. And I think that or conceiving issues. And I think that that's a big deal, because talking about our history, we're supposed to be like these baby making machines. And sometimes it doesn't happen that way. And that's terrifying to any woman, but especially a Black woman who's seen as someone who is just fertile and, makes babies.
Yeah, that's a whole nother set of history itself.
Oh yeah. Look, we're gonna have to invite you back to talk about that one. Yeah. Dr. Fountain, what is one thing that you wish Black families knew about play therapy?
I wish they knew that it can work and help them. And if they could, for some of them, just move past the stigma, look past the history, even if that means seeking out a Black clinician.
That's the first step. Yeah. Yeah.
And I know, and I'll say too, because when I first got counseling myself, I only wanted a Black clinician.
Right.
But in recognizing later, there are other people that can help me who may not be Black. But there are, for me, only certain things I can say to Black clinicians and know they fully understand.
Right.
And so also that they don't have to wait until it gets bad a huge part of my business is wellness. Like, I have parents calling like, I'm not quite sure that this is counseling worthy. And I say, you know what? Your mental health is always worthy.
Always.
Because there's a distinction between, illness and wellness. And just as your physical body, you also have that with your mental health. And everybody has mental health. Everybody. And so a big part is, if you want to just do check-ins to see if we can prevent and maintain mental wellness, that is great. Like, you know what? Let's just see what's there. And like, even right now, there's a lot of calls because just to do check-ins, like all of this going on with Black Lives Matter, with the pandemic and COVID, it's just overwhelming for everyone.
It is.
And so having parents call in and say, hey, I'm not sure if anything's going on with my child, but I really would like just to check in. That warms my heart. And a lot of times they'll be surprised just how much their child is holding in and not verbalizing, because they may be trying to put on the face for the family when they see everybody else crumbling around.
Absolutely. Wow. What do you see, or where do you see Black families struggling the most, and how can they learn from it?
I think what I see frequently is probably just managing child behaviors. I mean, that's always, that's the symptom, the outer look of, what always is the problematic, but usually there's some things underneath that.
Yes.
And so the behaviors kind of bring them in, or the lack of being able to manage the behaviors. And so just teaching, I mean, there's lots of handy skills. And I always say, parents, I think there's this duality of, if I seek out help, it makes me look weak.
Right.
Right. And I have a job that I have no training in. And it's a huge job, And so a part of it is humility. A part of it is trust. A part of it sometimes is just figuring out, this therapist isn't the right one for me, so maybe I need to talk to somebody else.
Right, right.
So I would just say, the courage, and I always thank my parents for their courage, not only for their child's mental health, but it also aids their own mental health. Building a parent-child relationship is a huge gift.
So many thoughts are coming to mind. I know one of the reasons why people struggle with connecting to their children is because they've had their own issues with attracting and connecting with their own parents. And just from what I'm hearing you say, this seems like a great tool to help. Because again, even though we are adults, like, I could totally benefit from just seeing even my child play and learning from a professional like yourself, and being able to detect, okay, what are they saying by doing this, or what are they trying to express by doing that, as a resource to really connect with our children better.
Yes, and this is where on my site we provide intergenerational care.
Love it. Oh, I love it. Yes.
And so particularly like if we're providing child parent psychotherapy, we have lots of intake assessment form, and that gives us lots of history about each parent's child-parent relationship. And then I help parents make those parallels. How is this showing up in your relationship with your own child? Or how has your relationship with your parent totally put you on the other extreme, providing parenting to your child? And so always focus on kind of that balance. Like, where do we see the balance? Because it doesn't help usually to be on either extreme. I've had families, literally, if there is an influence intergenerationally, okay, we'll bring in the grandmother or the grandfather with the parent and then with the child, so that we can all work together on this issue.
Amazing. All right. Can you give us, our listeners, 3 resources that you think they could assess maybe on their own to help with some of the play therapy tools or play therapy mindset or skills?
So The first one where they can just do some reading is the Association for Play Therapy's workshop. Website, not workshop. And it's A4, PT.org.
Okay. I'm going to put that in the show notes. You said A4PT.org.
Mm-hmm.
Okay.
Mm-hmm.
Now, would that be for PT? I'm writing it down as we speak. Is that going to be for the parent or the child?
That's for the parent.
Okay.
Yeah, no, the child's only job is to come in and play.
Got it. I mean, every time you say that, my daughter is 5, and you would be like the best. You know what I mean? She would look so forward to seeing you and being able to play, not even realizing that she's doing some mental health stuff.
Exactly. And that's what we want the child to experience. And do note too, though, that sometimes the assumption is that play is always fun.
Okay.
However, children can do some serious work in play that is seriously therapeutic and can be very focused, whether it's their grief, whether it's behavior management, whether it's trauma, whether it's just exploring relational issues. There can be lots and lots of mental health work that's often fun, but sometimes can be serious and therapeutic.
Anything that you would like to share about things that you might be reading or listening to? Maybe a podcast or a book resource that our listeners can benefit from?
Oh, geez. I need to go to my list of podcasts. I'm like, so many right now. And it just depends on, how deep you want to go. But let me see what shows I have on here.
Particularly those relating to, play therapy or work with Black families.
Oh, well, there's one called Brown Ambition, Therapy for Black Girls, or Play Therapy with Blacks.
Those are
that might be an untapped area.
Yeah. Well, hence the Marriage and Family Therapy Matters podcast.
Yeah.
We really are an underserved. Our community desperately needs us, but we are, few and far between. So that's why I'm glad we get opportunities like this to connect you. Great people, who are doing this work as well through podcasts, and people who need to have access to the information.
Oh, there's also 2 therapists and a microphone. They often will gear it towards parents in the community on their topic.
Okay. All right. Well, that's great. So, amazing people other podcasts that we can also listen to and learn from this work. Let's discuss a myth. Are there any myths? If there's just one myth about play therapy and Black families that you just want to set the record straight on, what would that be?
A myth that we're just playing with your kids.
Yeah.
I would even say that you have to be a perfect parent, because that doesn't exist. Yeah, I often have to help parents recognize where their grace and compassion lie, because that's very important. And I use this quote from Gary Landry, who's actually a white male, but and huge with the child-centered play therapy. But he said, it's not what you did, it's what you do after what you did.
Oh, wow. I love that. Wow. You brought such good stuff, Dr. Fountain, to our audience. Before we let you go, we want to let you know we're at a point in our show where we do what's called What's Good. And it's a part of the show where we apply this information to what could be a real life scenario for our listeners. Are you ready?
I'm not sure.
Let's see. It's going to be nice and quick.
Okay.
All right. Meet Daisha. Daisha is an 11-year-old African-American girl. Her body is well developed and she's beginning to experience hormonal changes. She currently wears a size C cup and she recently started her period. On one occasion, she was at school and she had an accident. Everyone laughed at her. Now she does not want to go to school when she's menstruating. She experiences heavy cramping and moodiness, and she doesn't understand what's going on in her body. She's far too embarrassed to talk about this. How could play therapy help her?
Oh, wow. Yes. So I'm hearing a couple of issues in there. One is I would wonder how much the parent has shared about her body in celebrating the beauty and the gifts, and even though it doesn't feel like a gift, of her body.
Right.
Yeah. How much she has learned just about naming her body part. And so that's one of the things I help parents do for young children or older if needed, in literally naming their body parts, because that's a preventative way to prevent abuse. And how much she knows about the growing body itself. I mean, there's a book called My Body, Myself that I often use with kids or parents with kids to help them explain their growing bodies. And so part of play therapy could help her, one, explore the different growing parts of her body. It could also help build self-worth, because I think that will be a huge thing, even recovering from the sense of embarrassment.
Right.
Group play therapy could help with kind of social skills and how to be assertive so that she doesn't feel like she's the target of bullying behaviors.
Awesome. Wow. Such great stuff that you've been able to share with our listeners today. It's been an honor, Dr. Fountain, to have you on the show. You've shared so much. I'm sure our listeners would love to be able to follow you online. Where can they find you?
So my website is www.playwellness.net. And we're also on a few social media channels. I tend to keep up more with Facebook, but I try my best with the other ones.
All right. So the main thing is your website and your Facebook page, both by the name of your business, correct?
Yeah, well, the Facebook is at Play Wellness LLC.
At Play Wellness LLC.
I think that's where most of them are, for the social media pages.
All right. Well, it's a blessing. I'll have all that stuff in the show notes too. So we want to make sure that our audience can find you if they need to. Thank you, Dr. Fountain, for coming to the show. You've been amazing. I've learned so much. I know our listeners have as well. Thank you so much, and you have a wonderful rest of your day.
Thank you, Dr. Omari.
Take care.
You too.
Bye-bye. Thank you for listening to this episode of the Black Marriage and Family Therapy Matters podcast, where we connect Black families to Black therapists. Since you've listened all the way through, come on in and join the family. If you haven't done so yet, please join our free community where we offer weekly trainings and monthly giveaways. We can be found on Facebook under the Black Marriage and Families Matter Facebook group. And since you're serious about joining our family, we also invite you to join our All In campaign, which signifies your commitment to go all in, not only for yourself, but in helping us reach more people by downloading this podcast wherever you are listening to it, leaving us a review, and subscribing to our YouTube channel. This really helps us reach more people and change more lives. After all, Dr. Martin Luther King once said, we can all get more done together than we can apart. With that said, I want to encourage you to share this episode with just 3 other people who you think might also benefit from our community and what we are offering, with the hopes that all of you can join our All In campaign. When you're done, simply click the link All In Campaign in the bio and receive a free copy of my course entitled Goodbye Toxicity, which is valued at $297. This course will help you to work through some of the difficult experiences that arise in most of our relationships, and it's completely free to you with your commitment to join our All In campaign. We look forward to connecting with you every Monday and Wednesday. Thanks for listening.